The GP partnership model, which has existed since the NHS was created, where, as you say, GPs effectively run themselves as small businesses, we are looking to phase that out. We're going to be consulting on that this year. But we've got to also scale up the number of GPs. General practice has such a critical role to play. It should be the best front door to the NHS, but at the moment it's broken, it's overwhelmed. We've lost 5,000 GPs in the last decade. That's having a big impact on patients, not the fault of GPs, it's the fault of the government.
But it's a big change to completely change that model. As you say yourself, it's been there since the beginning of the NHS. And you seem to have a bit of a beef with GPs. I mean, you've suggested that they get money for old rope for doing vaccinations.
No,
What's
I don't.
your beef with GPs?
I don't. I have a beef with the fact that people are waiting so long to see a GP. I have a beef with the fact that GPs are telling me that they're slogging their guts out, working late into the night. That's not a sustainable position either.
But
and in terms of
vaccination,
let me just clarify what I was saying on vaccinations, Laura. So I think pharmacy should do a lot more vaccination. Of course, there are GPs who say, well, hang on a minute, that's a big part of our income. We don't want to see other people doing vaccinations either. And I can understand
Is that a way to talk to a profession, to say that giving vaccinations to their patients, which may be life-saving, will certainly help them significantly with their health? Is that a way to talk to the profession, to say that they're charging money for old rope for providing health?
The vaccination programme is absolutely critical to our country. GPs, pharmacies, and of course the huge Jabs Army of Volunteer did a brilliant job on the vaccine rollout, something the government takes credit for, but GPs, pharmacies and others delivered. So look, I'm not trying to insult a profession that's slogging their guts out and incredibly burned out. Quite the opposite. I want more GPs, I want more focus and investment in primary care. And over the course of the 10-year plan for change and reform that I'm working on with Keir Starmer, we want to shift the focus of healthcare out of the hospital into the community, faster access to diagnosis, better, more effective treatment and better value for the taxpayer.